If you were Biden right now, Abdullah, what would you do?
What would I do is I would, first of all, I would say, we're in a pandemic. I would say, and I would like, the thing
I
is like,
do hear him say that.
well, no, I'm going to push back on that a little, because when during Christmas, for instance, when we really shouldn't have, when we knew about the spread of Omicron or whatever, he said it's safe for you to gather with your family members, without necessarily adding that the risk of hospitalization and death is lower, and that's how I'm defining safe, right? They want to have it both ways, where they're like, oh, wear a mask, get tested, get boosted, Google where you get the test, get the thing, but also we can run society as normal, which clearly we can't. We're seeing closures whether we want to see those things or not. And so that would be the first step, is to have a consistent message that the pandemic is still going on, that that the pandemic is still going on, that we really need to scale back our behavior, and put measures in place that you can put in place that are consistent with this, right? Show that you are more. You're trying to do more than like a vaccine only strategy,
right?
You're like,
if you put all your eggs in that basket in the vaccine,
Yeah.
there's fucking breakthrough cases. Well, then
Yeah.
you're done. Like, it's done.
Yeah.
It's very difficult to continue to defend. I mean, obviously, we're going to defend the vaccine, but you need a broader strategy than that.
Yeah, and I think what are your federal agencies doing that, like, people? One thing that frustrates me. I mean, I'm back and forth between Rhode Island and Texas, which both have, Rhode Island is blue, Texas is red, but both state governments, Texas is doing a much worse job. But the Rhode Island state government, because there is not necessarily that much pressure from the administration, no state in New England has a proper mask mandate, right? We have California does. Oregon does, Washington does. So what I constantly hear is like, oh, because some states won't do it, because some people won't do it, like, let's just, you can't do anything at all, right? And I would like to see an effort from the administration, a real genuine effort from the administration that, that acknowledges this sort of vaccine plus strategy, that we need a number of tools and a number of public health interventions. Yeah. And one thing that I always like to point out to people is, like, Democrats really get voting barriers, right? They get the fact that a lot of people don't have ID, that you need to go door to door to organize, to get people to vote, to get everyone, to get as many people as possible out to vote. You get that when it comes to voting. When it comes to vaccines, that was tried for like 2 months. And then it was like, oh, okay, go get it in a pharmacy, go get it in a thing. That's not to say that there's not significant anti-vax sentiment, right? But there has been a lack of
anti-vax sentiment.
Sorry?
But he
agreed.
Yeah. But there are barriers. You're saying there's barriers to actually getting vaccinated.
There's not to say that there's not. It's not to say there's not significant anti-vax sentiment. So of course there is, but also there hasn't been like a firm enough pushback from the from the Biden administration to promote these vaccines, to get them out to the people. And what I always find that frustrates me in public health is there's this almost barrier that stops people from even trying. It's like, why try if they're going to resist anyway? And that, for me, whether you're talking about public health or you're talking about voting rights or something, it's a consistent theme of why try, because this other side is more organized. They're going to resist anyway. So if you have that attitude, you've lost the battle before it can even begin. That's what I would like to see. As a Muslim, I always go back to what I call the Muslim band standard, or the Muslim band thing. Have I seen the Biden administration push for anything as hard as the Trump administration pushed for that ban? I can't say that I have. And so, because
they had their Stephen Miller in there. I mean,
yeah, like the Trump administration, as disjointed and as incompetent as they were, for their own agenda, it was just like, we'll try this, we'll try this, we'll try this, we'll try this, we'll hit this,
so much passion
until it sticks. With the Biden administration, it's like, okay, we'll do this one thing. Oh, we can't, like, we put our hands up and stuff. And that's what I think what really frustrates me is, we don't, in public health and specifically, we haven't seen that attempt. And in fact, we've seen undercutting of our own messaging and our own attempts.
Yeah, I would agree.
I think for me, I'm sure 100 million, 1,000% right about everything you're saying. I think for people, there became a disinterest in what any public health officials, including Dr. Fauci, had to say, because I can speak for myself, and I'm sure lots of people who didn't even get the vaccine, even though we did, because I felt lied to about the vaccine, because the vaccine didn't do what they said the vaccine was going to do. I mean, everybody at our super spreader event was all vaccinated. We had to do proof of vaccination. We all got tested before we went in, and then everybody still got it. So
Right.
it's like, well, I think it becomes just a lack of trust in the public and public health officials and the word
Right.
of what they're saying. It's just nobody believes. Nobody knows who
No,
to believe.
And
anymore.
rather
I
than
agree.
maybe,
Yeah.
and is it possible, and is it, what could it, and shouldn't it be a public health thing for our elected whatever officials to be like, you know what, we actually don't know. So
Yes.
we don't know. So we think this, and we heard a little bit. That's why we're wearing masks.
So
That's why we got the vaccine. That's why, but you just don't know.
yeah, and if I can, so basically to provide some perspective, there is the public health rank and file, right? Who are people who are working in health departments, people who are working in universities and stuff, and then there are public health officials who are at the behest of the administration. The CDC is technically an independent organization, but they get pressure from the White House to go a certain direction, and just like we saw with the sort of Delta Airlines guidance. What really made us, the turning point that I can see in this whole pandemic was in May, when the CDC said, you can take your masks off if you're vaccinated.
Yes.
That was not, we were not at that point. We were not at a point in the country where we could get, where we had reached that threshold. And even honestly past that, like I am originally from Toronto, like a long time ago. I used to live there, and my friends in Ontario, until the new wave hit, they had like a couple months of semi-normalcy because everyone was like still wearing a mask and stuff, but life or otherwise returned to normal for a couple months. And so that was what I think was the first sort of turning point, was in May, when they said, okay, you can take off your mask. And then the CDC guidance, was like, okay, well, now the cases are going up, so put your mask back on. Oh, like with the isolation guidance, right? You can't do this, you can't do that. I have always advocated for is being clear and responsible, clear to people about what this actually is. The pandemic is unfair. It sucks. Like it's not a rational actor, whether you're left or right, whatever you believe. We can't escape it unless we actually do something about it, right? We can, as we can see, right? It's clearly having an impact on our lives, whether someone chooses to ignore it or whether someone doesn't choose to ignore it. Like we're all miserable about it. So, and it's a thing we can't necessarily. It's a virus, right? It's not like I think some people have the attitude. It's like, oh, like this is so unfair. Like as if a politician can kind of wave COVID away, which we can't. Like we can have better strategies to manage it, which I'm asking for. But it's a virus. It's going to be unpredictable. It's going to require patience, and it's going to suck. But if we don't, engage in, if we don't, be patient and try these things, it'll only we're just kicking the ball down the road.
Yeah. And I think and I totally echo what Julie's saying, that having some sort of humility about how uncertain these times are and how scary it is, I think is really nice. And I would love for Biden to have a cavalier notion in nature about voting rights and about the Build Back Better Act and about the filibuster reform, and then have sort of, more caution and thoughtfulness and, reverence when it comes to the pandemic. Instead, we're switched on that. He's like hella cavalier about the pandemic and, really, really cautious about, well, I don't know, cinema, what's she going to think? She's tough as a devil, or whatever the hell he said about her. What's going on, Frantifa? If you haven't already, subscribe to this channel right now. Hit that button. And also, you can become a patron and support the show every single week. Get access to bonus episodes and exclusive merchandise. Patreon.com/Bitchuation Room. Do it.